In this video, we're going to talk about a popular peptide called Thymosin Beta 4. If you haven't heard about it, we'll discuss what TB4 is, how it works, what conditions it might help treat, and talk about potentially how to use it and where to get it. My name is Dr. David Geier, double board certified orthopedic surgeon, sports medicine specialist, and media medical expert. I hope you feel and perform your best regardless of age, injury, or medical condition. Please understand in this video, like all my videos on this channel, any of my live streams, I'm not giving you medical advice. This is meant for general information and educational purposes only. So let's talk about TB4 or Thymosin Beta 4. I've gotten a lot of feedback and a lot of comments from viewers and readers over the last few weeks talking or asking about peptides. If you remember, I talked about the peptide BPC 154 and muscle healing and tendon and ligament injuries. I've done videos on my website and on YouTube about this, and many of those people commented that they'd like me to talk about other peptides and how they're used, what kind of injuries they might be used for, that kind of thing. So that's what we're going to do today, and that's with another very popular peptide called Thymosin Beta 4 or TB4, also called TB500. If you haven't seen the BPC 157 videos, let me review what a peptide is. A peptide, it's a short chain of amino acid, a small protein, so to speak, naturally found in our bodies, naturally made in our bodies. The one most people have heard of is insulin. Insulin is something our body naturally makes to handle the glucose that comes in from our food. We make peptides naturally in all parts of our bodies. More than 7,000 naturally occurring peptides have actually been identified that our bodies make. They're involved in almost every bodily reaction and action that goes on. They're signaling molecules or communication signals, basically master controllers of functions throughout the body. Things like hormone production, cell signaling, cell-to-cell communication. Each one has a specific role, although some have multiple roles. The peptide binds to the receptor of a cell, causes a chemical reaction, and then goes away. Peptides are thought to have a very short half-life, so they're thought to be extremely safe. That's thought to be one of the big differences between peptides and hormones like steroids, which stay in your body a long time and can cause all kinds of effects, good effects and bad effects. Now, we naturally have really high levels of these peptides as kids and young adults, but our levels of these peptides decline with age. It's thought to be one of the reasons that many tendon injuries occur in people in their 40s and 50s and not in teenagers and young adults. Now understand, many of these peptides are still considered experimental by the FDA. The FDA is currently looking into the pharmacological assessment of these peptides. As of 2018, about 60 had been approved by the FDA. There's about 150 that are being developed clinically. Several hundred are being tried or being tested in clinical trials. More and more of these are going to come out as pharmaceutical drugs by the big pharmaceutical companies in the coming year. And again, please understand, I'm not giving you medical advice. I'm not trying to influence you one way or the other about peptides and whether TB4 is right for you. I just want you to understand them at least a little bit better. Now, Thymosin Beta 4 is a peptide produced naturally in our thymus gland. It's a 43 amino acid sequence found naturally in all of our cells, but studies have shown it exists in much higher concentration in areas of tissue damage and muscle damage and things like that. It's been shown to have what we call pleiotropic effects, meaning it has effects in multiple parts of the body, multiple organ system. Most of the studies on Thymosin Beta 4 show its benefit for liver disease, alcoholic liver disease, liver fibrosis, eye injuries, eye infections, peripheral neuropathies, strokes. It's even been shown to help with hair loss and is actually used in a lot of treatments for hair loss. Hasn't been studied as much for orthopedic injuries like muscle injuries, tendon and ligament injuries, and osteoarthritis, and I've done an extensive scientific literature search. But given how Thymosin Beta 4 works, it's at least easy to understand that it might be helpful for orthopedic injuries. TB4 has been shown to help improve healing in a number of ways. It works at a cell level, supporting tissue stem cells to heal and regenerate injured tissue. It enhances collagen deposition. It reactivates progenitor cells to repair damaged tissue, promotes rapid wound healing with little to no scarring, and it's a potent anti-inflammatory for wounds, muscles, joints, helping to reduce acute and chronic pain. At a cellular level, it upregulates cell building proteins like actin, a protein that along with myosin in muscle cells forms our muscle contractile filaments. Upregulating actin allows TB4 to promote healing, cell growth, cell migration, and cell proliferation. One of the great features about thymosin beta 4 is that it travels to the site of injury, which is probably why you see it in higher quantities and higher concentration in areas of tissue damage. Again, there isn't a lot of research on TB4 for muscle, tendon, and ligament injuries, but several peptide experts believe that it might be very helpful for muscle injuries like hamstring muscle injuries or hamstring tendon injuries, calf injuries, quadricep injuries, tendon injuries like tennis elbow, Achilles tendonitis or tendinopathy, and rotator cuff injuries. It's been shown to prevent adhesion and fibrous band formation in injured muscles, tendons, and ligaments. Basically, when these structures heal, they heal with the fibers kind of haphazardly aligned, sort of, if you remember as a kid the game pickup sticks. In theory, thymosin beta 4 might help those muscles and tendons and ligaments heal more quickly with the fibers, the collagen fibers, more normally aligned, better aligned, so you get normal function and strength quicker with that peptide. As far as how to take it, TB4 is usually administered as an injection that you give yourself as a patient. Now, there are oral forms of TB4 and TB500, but there's debate about how actually bioavailable TB4 is when you take it as a pill. Also, it's very important that you consider that if you want to try a peptide like thymosin beta 4, you need to get it from your doctor and not these online sites that sell peptides for research purposes only. It's really, really dangerous. You just don't know what you're getting. The websites look legitimate and they make all kinds of safety claims, but these companies are not inspected by the FDA. There's also a possibility there'll be very little of, if any, peptide actually in the vial or bottle. They often contain contaminants and endotoxins that can make people really sick. I've heard reports of people getting liver damage from peptides that they bought online. Remember, most peptides like thymosin beta 4 are not approved by the FDA. They're not considered standard of care for most injury and diseases. And I'm not giving you medical advice. I'm not trying to influence you one way or the other about peptides like TB4 and whether it's right for you. I just want you to understand them better and consider talking to your doctor. Also understand that for athletes, if you're drug tested, it is banned like BPC and like some of the growth hormone releasing peptides. They are banned by the World Anti-Doping Agency. Now, I know theoretically, they don't tell you, but I'm pretty confident that these are very widely used in professional sports and powerlifting and bodybuilding and things like that. Thymosin beta 4, in my mind, is more to help structures heal than any performance or strength benefit or thing like that, but it is banned by the World Anti-Doping Agency. Now, if you like videos like this one, you want more information about optimal health and wellness, healing and recovery from orthopedic injuries so you can feel and perform your best regardless of age, injury, or medical history, subscribe to this channel. Click the bell to be notified when I start a live stream online, when I release a new video. Also, if you have an orthopedic injury and you want to see somebody who truly knows about bone and joint injuries in athletes and active people, I'd love to help. I'm a double board certified orthopedic surgeon and sports medicine specialist, and I'd love to talk to you about all your treatment options, not just surgery, not just cortisone shots or physical therapy, but all kinds of options. So go to my website. There's a link in the description below, but it's drdavidgeier.com. On the homepage, you'll see in the upper right corner a drop-down menu for Work With Me. There's a contact page that you can fill out the form and request an appointment, or we can talk about other ways to work together. Again, that's drdavidgeier.com, and that link is in the description below. Again, thank you so much for watching. My name is Dr. David Geier. I look forward to helping you feel and perform better than ever.